Thinking about hip replacement surgery but feeling uncertain? You're not alone, and you don't have to stay in pain.
I know that coming to a foreign country to get a problem dealt with or handled, it's not an easy thing, definitely. I've actually been a patient myself and I've traveled abroad, so I was there actually in the shoes of a patient. So I know it's not easy, but the way to tell patients to be confident is that first of all, we know what we're doing.
Join Dr. Gerardo Mangino, a leading orthopedic surgeon with 21 plus years of experience, as he explains the procedure, recovery, and implant technology that helps you return to normal life faster and with far less pain.
For hip replacement surgery, when do patients typically seek hip replacement surgery?
Well, hip replacement is also a very popular procedure. Hip replacement is replacing the joint between the femur and the pelvis. Some patients confuse the hips with the lower back. Some patients come and say, I have a lot of pain in my hips, and they point to their lower backs. Hip is basically the joint between the femur and the pelvis. A hip replacement is replacing the femur, the ball, with a socket. So that means that this is an artificial implant that goes inside the bone like this, and then a socket that goes into the socket. Between them there's a metal or a ceramic ball and a plastic liner. Okay, so that's basically the hip replacement. So when a patient has the cartilage worn out, again, bone on bone, because of any specific reason, could be again illnesses, or could be just wear and tear or degeneration, we go ahead and replace the hip joints. How we do the operation, how we approach the patient, there's a little bit of a difference. For example, on knee replacements, usually we go through the front of the knee. Now on hips, there's different ways to access the joint. We can either go through the back, through the side, or through the front. Either way, either approach usually has very good results on the long run for most patients. There are differences, and this is a popular question. Why do we do the anterior or the direct anterior as opposed to the direct lateral? It's a matter of preference for the surgeon. In the long run, or the mid to long run, the results are pretty much exactly the same. It just varies on the early recovery time for some patients when they get the direct anterior approach. We do use the direct anterior approach, not in every patient. We select our patients very well. We don't do it in all the patients, but we do consider doing it on patients who are good candidates.
Excellent. Okay, I almost forgot. What is also the difference between total hip, partial hip?
Well, a total hip is replacing the full joint, the ball and the socket. That's a total hip. A partial hip is replacing only the femoral part. That means that we use a stem and the ball, but we do not use a socket. We use the own patient's bone right there as a socket, or as their own socket they have. That's a partial hip replacement. And there's also questions about resurfacing of the hip. Resurfacing of the hip is, we do not cut the ball on the femur. We leave the ball and we just shape it and put like a metal cap and a shell here. We normally don't do that anymore. Sometimes during the past few years it has been popular, then it lost popularity. So we just tend to do straight total hip replacements.
Excellent, Doc. Now, you already mentioned the good candidate part. What makes them, again, not a good candidate?
Also, a patient who probably won't be a good candidate for hip replacement. Again, patients who have a history of prior illnesses and morbidly obese, BMI over 40, 45, Those are patients that we do not consider good patients to have a hip replaced because of the risk of short-term complications or even long-term complications. That could be either infection, blood clots, and also on hips, and as well as knees, but mostly on hips. They can have either fractures or loosening of the components inside the joint or inside the bone. That can lead to different outcomes and more surgery or more issues with the patients.
Absolutely. So it's typically the same with the knee.
Yes, it's pretty much the same. Pretty much the same. The surgery takes around an hour and a half to 2 hours, depending again on the patient, depending on the approach that we use, depending on some things of the anatomy of the patient. But normally that's how long it takes, between 1 and 2 hours. And the same recovery time, usually it's just walking the same day or the day after of the surgery, depending on the time of the day we did the surgery. Normally patients can put full weight on their hips, because many patients think that something is going to either come off or break or something, and that's totally normal because we're replacing a big joint. But patients can put full weight right after, unless we tell them not to. Patients start rehabilitation right away inside the hospital with a physio session the day after surgery. Normally, patients for a hip replacement will use a walker for the first few days just for safety. Some patients get rid of the walker in a few days. Some patients use it for 1 or 2 weeks, depending on how safe they feel and how strong they are. But usually that's a recovery. A full recovery time for a hip replacement is actually a little bit faster than knees. Hips will recover as well between 4 to 12 weeks, but usually patients are feeling better sooner and with less pain almost right away, also depending on the approach we use. But patients are basically doing a pretty much normal life between 6 to 8, 10 weeks.
The brands also is kind of like the same with what you mentioned earlier.
Brands we use also basically Zimmer Biomet, sometimes this same company that I mentioned, Corintec, and sometimes we use now and also a European company that has very good implants. It's a French company, it's called Evolutis, and we've used those implants many times with very good results as well. Depends on the patient's preference, because unfortunately some companies are a little bit more expensive than others. Some doesn't mean that one have a better quality or not. It's just the manufacturing and some things to do with the prices from their own companies. So it depends.
My name is Nancy Rossiter. I am from Toronto, Canada. I came to Dr. Mangino to have my right hip replaced, and that was on the 22nd of November of this past November. My experience was outstanding. The doctor was very regularly coming in to see me. My surgery was near the end of November. Actually, on Monday coming, I will be having, I believe it's a final appointment checkup with Dr. Mangino. He made himself available the entire time that I was home healing, with giving his direct number. So if we had any questions regarding the medication that he was prescribing, or any other question, we could reach him, and he was always calling back immediately unless he was in surgery. So in my opinion, I had an outstanding surgeon and I had an outstanding result. I am in no pain. I am walking extremely well. There's almost nothing that I can't do.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.